Hello and welcome to McDougall's Medicine with Dr. John and Mary McDougall. I'm your host, Heather McDougall, and their daughter. I'm very excited for tonight's AMA. It's Breast Cancer Awareness Month, so we thought we'd start out with questions about cancer, and then if we have time, move into general questions. So great to see you all coming in tonight. Welcome, glad you're here. Hi, Mom and Dad, Dr. McDougall and Mary, how are you?
Oh, we're
Hi,
good. We're
we're
good.
great.
We need, okay, I can see us. Is there a way you can make us in a speaker view though?
Sure, let's see what I can do.
There, that's perfect. The show has started. So anyway,
Nice to see you both.
I'm John McDougall. This is Mary, and Heather's our moderator, and we meet with you every Sunday night at 5 o'clock. To get your interest in what we're doing, because we have some important things to share with you.
Absolutely. Well, so let's get started. We've got lots of things to talk about tonight. Lots of questions that came in about breast cancer. This is an important month to really bring awareness to this topic. You've been studying it for decades and have so much to say about it. So do you want to start out talking about it a little bit, and then we can get into questions?
Yeah, I would say 4 decades. I've been studying it. And I got my interest beginning when I was about 20 years old. My Aunt Margie, she was 52, and she developed breast cancer. And of course, I had no understanding. I wasn't even in medical school or interested in medicine at that time. So I was about 20 years old, and I watched what happened to her. She went through 1 mastectomy, and then 2 mastectomies, and then radiation, and then chemotherapy. And every time the family got hopeful that this was going to turn her around. And I watched her die. It wasn't pleasant at all. And it left me with an interest in this disease, breast cancer. And then my brother, who's a medical doctor, his wife at age 28 developed breast cancer. And they had 2 children at that time. And again, he is a medical doctor, a board certified internist, and he had all the knowledge available in terms of what I'm going to share with you now. But he and his wife elected to go through standard medical therapies and a lot of alternative therapies too. Neither one of them wanted to be disappointed in looking backwards and saying, well, I didn't do everything. I didn't listen to my doctors, and I didn't try all the different naturalist therapies, et cetera. And but that's the thing that she didn't do, which I feel was quite disappointing, is she didn't listen to what I had to say. This was one of those relationships between sister-in-law and myself that whatever I said, she didn't believe and was going to make sure that I wasn't right.
Especially about the food.
Especially about the food. But you know how these things go. I don't have to talk to you about how families work. But anyway, she had 2 children and eventually died at age 32. She lived for 4 years. And it was devastating for my brother. As a medical doctor making a really, really good income, he went bankrupt, and he had to live in my patient's basement for a year. My parents' basement for a year. It was quite traumatic on my whole family. And then when I got in medicine and medical school and so on, I looked at various areas that I thought I could make a real difference in, where I thought that people were terribly mistreated. I got focused on the interest in breast cancer. And I'd have to say that probably I know more about this subject than any of the other subjects that I deal with as an internist is breast cancer. And so I've spent my career taking care of women who have breast cancer. I published the first study ever published on the dietary treatment of breast cancer. I did that in 1984 in the journal Breast. And, I strongly believe, in fact, I think the proof is there, that the diet is involved in giving you breast cancer, and that once you get breast cancer, as well as other solid tumors, if you change your diet, you will change the course of this disease. And I showed you the first night of October, how cancer grows, how it doubles every 100 days on average. Well, that's on average. Some cancers double every 25 days. That's not good. Some cancers double every, say 500 days. That means you die when you're 185. That's good. So you can change the doubling times by improving your general health, improving your immune system and stopping the poisons that give you breast cancer. These poisons, they go all the way from the fat in the food to the estrogens produced that you produce in your body to the estrogens you take outside. But also, if you want to get down to the real root of these cancers, I think you need to look at environmental chemicals. I think they're probably the initiator of most kinds of cancers are environmental chemicals, and you get most of those from the food. So I've been in this a long time. As a medical doctor, I have a particular concern about gender bias. And that means that we're taking care of a woman's disease, and most doctors up until recently have been male, men doctors. And unfortunately, because of this, I think women have gotten an unnecessarily bad shake when it comes to treatment. But I think they could all be changed if people understood that prostate cancer is the same as breast cancer. It's analogous. The embryology of the prostate is analogous to the embryology of the breast. Its growth and maturity are similar in the breast and the prostate. As far as when it gets sick, with diseases like fibrocystic breast disease or fibrous prostate disease, similar. When it comes to advancements of cancer, the natural history, I told you that it takes 10 years before the tumor gets big enough in the breast to feel it. Well, it takes 10 years before the PSA, prostatic specific antigen, starts to be produced by the tumor mass in the prostate. 10 years, it's a 10-year-old disease. And it goes on to the therapies. In other words, chemotherapies have been largely a disaster. Hopefully some of the new stuff that's being developed is going to give the cancer businesses a better reputation. But right now, I don't think the prisons are big enough to, put people in that have done some bad things that they knew were bad to people. And you know what I'm talking about. So, things may be improving when it comes to both prostate and breast cancer, but not much. And you're still given standard therapy, both chemotherapy, radiation, and surgery. Again, analogous to the breast and the prostate. So,
do you think that's because they're both stimulated by hormones?
Yeah, that has to do with it. Yeah, both involved in the reproductive process.
Yeah.
So yeah, I think you hit on it, Mary. The hormones are very important when it comes to and that's part of the embryology, part of the development of the prostate or the breast. You get estrogens being produced in the breast tissues; they proliferate. The same thing with the maturity of the prostate gland. The testicles start producing testosterone. You get testosterone from other things besides the testicles, and you start developing the prostate. So yeah, the analogy is huge. So listen, guys, this pertains to you too.
So you have been very outspoken that women should not get a mammogram. And I'm guessing men should not also get a prostate exam, right? So how are we supposed to figure out we've got cancer?
Well, this goes, it deserves a couple other statements, Heather. When it comes to gender bias, men are told that they have options when it comes to treatment. They're told they can do nothing, in other words, watchful waiting, or they can have radiation, or they can have surgery. We've been telling men that for 20 years. Why? Again, I think it's because it's the male-dominated medical business. We give our gender colleagues, we give them some advantages there over women. Whereas women, you're hounded to have these tests and treatments done. And still, as far as the outcome goes, they're all failures.
But they still recommend
survival outcomes, living longer.
They still recommend that men have prostate exams, right?
No.
Well, how about PSA tests?
Well, they still recommend those, but not as enthusiastically as they once did. But prostate digital rectal examinations are pretty much condemned by most medical organizations. U.S. Preventative Services Task Force, Kaiser Permanente, they condemn. Their studies show that you shouldn't be doing digital rectal examinations. I don't know. I'm not going to. I was going to tell you one other analogy, but we're not going to do that. Maybe if you become part of the 12-day program, I'll tell you the analogy between doing examinations of the breast, digital self-examinations or examinations done by your partner, And extending,
That's
extending.
enough. That's
Okay.
enough. Yeah,
Forget the prostate. We're not going to go there. Some of you have probably caught on to what I had to say, though. Anyway, this is
So what do you recommend? What do you recommend women do? Should we examine our breasts at all? Self-exam in the shower once in a while?
I think you should. I think examining it whenever you take a shower, which may be once a day, once a month, once a week, is plenty.
Yeah, but how would you examine it? I mean, when I take a shower, I just wash. I don't.
Well, then you ought to wash a little more carefully.
Really?
Yeah, well, yeah, you know,
is a lump going to be
so
noticeable?
evident.
It is going to be so
It'll
noticeable.
feel like a marble.
Okay.
It'll feel like a golf ball.
So you're
not going to
notice it
miss
just
it
when you wash it.
Yeah, that casually you should
Okay.
do. That's the kind of casual recommendations I give you. And at that particular stage of finding it on casual examination, you know, the shower is just an analogy to tell you how infrequently you ought to be doing it. You're at a stage where it still hasn't grown through the skin, which is a whole messy problem. It's gotten to the stage where it hasn't grown into the muscles, which again creates some problems when it comes to treatment. But it's still spread, you know. As we talked about the first night, your cancers, your solid tumors, prostate, colon, breast, they start to spread through the venous system to the lungs, the brain, the bones, you know, during the first few months of having cancer. And it takes 10 years before you can find it. You know, so it's already a systemic disease, but it hasn't gotten to the point where it causes enough local problems like growing through the skin or into the chest muscle, problems that you don't want to have happen. That casual examination, you know, if you enjoy my analogy, when you take a shower and you do that
so
kind of
it's just usually on the surface then.
Well,
You would notice it just by casual washing.
Yeah.
Okay.
And again, of course, that would depend upon the size of a woman's breast versus the tumor and how hard or fibrous the breast was as opposed to being soft. And when you find a lump, that you can distinguish between a lump that's cancer and one that's not. You know, not totally accurately, but there is a difference in feel. Cancer comes from the word crab. Okay, and it grows out. The tumor mass grows out with crab legs. So you have these feelers that extend to other parts of the breast tissue, which lie outside of that tumor mass. It is fixed. These tumors get stuck to the surrounding breast tissue, and they get stuck to the underlying muscle and skin. So if you have a fixed tumor, you more likely have a breast cancer. These cancers are solid. They have no nerves in them. You never feel them. They're never painful. Not from the cancer itself. Whereas if you have say a fibroid adenoma or a cyst in the breast, it's smooth, it's kind of roundish or oval shaped, like, round like a marble or like a jelly bean. It's very smooth when you feel it. It's soft, it's pliable, you can squeeze it. You don't have these feelers sticking out around it, and they sometimes hurt.
Okay.
And so you can get a good idea as to how worried you should be. But the only way you could diagnose breast cancer is under the microscope. You can't diagnose it with a mammogram. You can't diagnose it with a breast self-examination. You got to take a little piece of the tumor out and look at it under the microscope. And an experienced pathologist can tell you whether or not this is a serious problem. But there are all kinds of difficulties under the microscope. And that's why you need an experienced pathologist. And sometimes a breast specimen has to be sent off to several laboratories before they come to the conclusion that this is real breast cancer.
So you don't have to take the whole thing out to find out. You just have to take a little piece out?
Yeah, a little bit. In fact, they do needle biopsies, or they did. I don't know whether they do them anymore. The reason they may have stopped doing them is they were worried about the tracks. When you suck the needle, you take the needle out of the breast, you have a track that you leave cells, and they're worried that, so, they may have stopped doing needle biopsies. Certainly we talked about it at one time or another. But yeah, you just take a little tiny piece, bigger than microscopic piece of breast tissue out, and you look at it under the microscope, then you are dealing with another question. Is this the kind of cancer that's spread or not? In other words, we call it invasive breast cancer.
Can you tell by looking at it?
Under the microscope, you can, because you see it grow from on the ducts. You've got a ductal tube. You've got little cells on the inside. You see the cells breaking through the walls of the duct, and you know that they're going into the. You can actually see them going.
You would see that even on a little piece of.
Under a microscope.
Okay.
All right. So you can imagine you've got like a straw here. You got a tube.
Yeah.
You've got the cancer cells are on the inside.
Yeah.
All right. And then you've got the duct, you've got the wall of the duct.
Yeah.
And then you've got the blood vessels. And you see these cancer cells growing through the wall, and not just only of the duct, but into the blood vessels. You see them actually growing into the lymphatics and blood vessels. And then you call it invasive.
Okay.
Okay. Well, there's another kind of cancer, which is really common, which is often confused. And too often women are told they have breast cancer and they don't. Because one of the important criterion for breast cancer is that it is invasive and it spreads. If it's confined to the ductules, in other words, it hasn't gone through the wall or into the lymphatics or the veins, if it's called carcinoma in situ. Does in situ sound like something that's in the site?
In one site, yeah.
Yeah,
in
it's
one
in this,
spot.
that's what carcinoma is situ. And this is not real breast cancer. In fact, there's been great efforts to get doctors to stop calling this carcinoma in situ. We want to give it another name so that doctors and women don't react.
Because they hear the word cancer and
Yeah.
they think they have breast cancer.
Absolutely.
Okay.
In fact, in this interview you're going to listen to, I don't know how Heather's going to put it up. And I want to talk to you about this a lot during our time together. Is I did an interview with the former head of the Cochrane collaboration, the world expert on mammography, Peter Gotchi. Okay, Peter Gotchi. He's from Copenhagen, Denmark, and we did an interview this week, just a few days ago. And he's written books like he wrote a book called Mammography: Truth, Lies, and Controversies. All the data is there, all the science. You want to talk your doctor out of recommending mammography? Then you hand him this book. Or we're actually going to put up a scientific paper. I think it's in the Journal of Thoracic. And it was a summary paper that Dr. Gotchi published.
Oh, it'll probably be a lot easier to understand.
Well, it's a quick read. This is a thick book. You can just read it and the doctor can react based upon this short paper, which is a scientific journal from one of the smartest researchers in the world. Anyway, in our interview, we talk about this carcinoma in situ and how we should stop calling it carcinoma in situ. It's a scary name. And it's not just Dr. Gotchi. It's not just myself. It's thousands of doctors, tens of thousands of doctors all over the world who are trying to get this name change done so we can properly classify, the disease and what the history is going to be. Most carcinoma in situs, you never hear about them again. They don't spread. They don't threaten the woman's life. They just kind of sit there.
But most people that have them have serious surgery done.
They throw the kitchen sink at them.
Yeah.
They have.
They end up with chemotherapy and
sometimes
and
radiation, commonly radiation, and extensive breast amputation. And
it's not
they
necessary.
certainly get, in most doctors' practices, unless it's changed in the last few minutes, in the most doctors' practices, they get a lumpectomy plus radiation. Plus, you may get anti-hormone therapy. That's another way that it's treated with tamoxifen or aromatase inhibitors. I don't know whether or not anybody's giving powerful, highly toxic cancer chemotherapies for this condition presently, but it's been done in the past. Like I say, there's nothing that when it comes to something as serious as breast cancer, there's nothing you want the doctor to withhold, unless it causes more harm than good, unless it ruins your life. And these treatments do, and that's why they need to be stopped. And that's why we've decided to take on, at least for a few moments of this discussion, at 5 o'clock on Sunday, like we do every Sunday at 5 o'clock Pacific time, to pay honor to Breast Cancer Awareness Month, which was started by AstraZeneca drug company, which made tamoxifen. This is Breast Cancer Industry Month, ladies and gentlemen. This is to promote the business. So anyway,
So some questions are coming in about cancer. What would one do after being treated for breast cancer and have had clear mammograms for the last 5 years?
stop getting mammograms. Stop seeing your doctors. Follow-up visits, you're routinely told, or at least, most patients are told, you have to come back for a follow-up visit. Why? If there was some therapy that would help me, why didn't you give it to me in the first place? What are you holding off for? And then what happens is it ruins the woman's life. She sits and worries about what the doctor's going to find for a couple of weeks. She goes in and the doctor may say this or that, or recommend this test or that test, and she's sure it's bad news. She's sure this new mammogram is going to reveal more bad news, and sometimes it does. But, it didn't do you any more good finding it after you were treated with breast cancer than before you were treated with breast cancer. So I recommend strongly against getting follow-up visits if you've had breast cancer. There's nothing good to be had, except you contribute to the financial welfare of the whole medical business. But not for you. You should stay away from these people. So you stop mammograms, you stop bone scans, which you'll do routinely to see if cancer spread to the rest of your body. Okay, I already told you, in most cases of real cancer, it has. They don't need to go looking for it. You can't see it unless the tumors that have spread to the rest of your body are like a half an inch in size, a centimeter in size. They have to be that big for you to find them. And by that time you've got a billion cells in your tumors.
Well, what if you have breast cancer and 10 years after they find the lump, you discover that it's all over your body?
Okay,
do you recommend chemotherapy then?
Well, there's some new chemotherapies out, and I quite honestly, I have to look at. Do you remember? What's the name of that?
What?
Remember the one where I was telling you? Kisqali, that's one. Yeah. Thank you very much, Heather. So they're bragging, and what you ought to know is what I'm telling you is the truth, because in their advertisements they tell you this is the first chemotherapy regime that's improved survival. Well, what that tells you is the last 50 years of chemotherapy hasn't. And they're advertising this new drug regime. You've got to take an aromatase inhibitor with it. And you take this new drug, and it's supposed to give you some more time.
And what are aromatase inhibitors?
Well, they're anti-estrogen drugs.
Okay.
There are various names for
like tamoxifen.
No, tamoxifen is different.
Oh, okay.
But it does the same thing. It blocks estrogen activity.
All right.
Anyway, when you ask me, are there any good cancer chemotherapies? Well, maybe there's some new ones that are working. I don't know. I haven't decided yet. I've actually had a couple of patients go out for these therapies, and it's not been good for them. But I'm withholding my judgment until enough studies are done and enough experience been had before I get too enthused about it. But the ones they've been giving you for the last half a century, I can pretty much tell you they didn't work. And the new advertisements on TV are telling you the same thing, because we got a new one. We finally got one in the year 2022 that works, because the rest of them didn't. And they tell you about that. And that's something. Those drug companies, wonderful. After it's found out that it's a failure, they're not going to tell you. You have to wait until there's another product that they can sell, and they have to get rid of the old products, get them off the marketplace.
Well, they keep trying.
They're good. They got all the money.
Yeah,
they offer all the money,
Billions of dollars for research, so they keep trying.
Well, I understand why. I mean, these are dedicated professionals who really want to help women. And this is interesting science, and they really want to get involved in it. I understand. It's great being a medical doctor with the hope that you can help people. And women are desperate, and they want to be helped. But you don't want to be helped at the expense of being harmed when the help is limited or non-existent, or is limited or non-existent, and the damage is real. Anyway. Boy, we've gotten into breast cancer a lot more than we thought I would. But anyway, there's this interview with Peter Gutsi that I did this week, which talks about mammograms.
It was a great interview.
Yeah, you listened to it on the side.
I listened to it, yeah.
So Peter's a great guy. He's a tough guy.
But he knows a lot about breast cancer and mammography.
He's probably the smartest man in the world. And I say that without any hesitation.
Yeah.
When it comes to this disease. He was head of the Cochrane collaboration. Yeah, he was one of the co-founders of the Cochrane collaboration.
Well, most people don't know.
Anybody
what the
that's
Cochrane
involved in
collaboration-
medicine or science knows about Cochrane.
Yeah,
and
but
Cochrane-
regular people that are listening to the show maybe don't.
They'll have to believe me.
Well,
Or you'll have to ask
You have to
somebody who's in
Google it.
medicine. You have to ask somebody who's in medicine whether or not Cochrane's to be listened to. Cochrane's to be listened to. And you're going to ask people in China, in Russia, in South America, all the researchers will tell you the same.
Heather's right. You can Google it.
You can Google, there you go. Anyway.
Can I give you another cancer question?
Yeah.
This is from Jennifer. She was told to get an MRI with contrast of my brain for life every 5 years after a pituitary adenoma was removed.
Okay, but that's not a cancer, Heather. Pituitary adenoma is a non-cancerous tumor. Okay, and what they're looking for is they're looking for growth of this adenoma. This is not cancer. It doesn't spread to the rest of the body. It's not. This is the pituitary gland develops swelling in it, develops a tumor mass. It expands this tumor mass and it compromises other brain tissue. Like you have problems with vision because your optic nerves go by the pituitary.
Well, where is the pituitary?
Deep inside the brain, right in the middle.
Okay.
So you've got the optic nerves going by, and when the pituitary expands to a certain size, it squashes the nerves and you lose vision. This is not good.
So that's why they want to do.
That's why they want to do repeat
scans.
MRIs, is to watch to make sure it doesn't grow to the point where it starts compromising vital brain tissue. And if it gets to that point, then they're going to do something. And to do something could be surgery.
Well, so that would be okay.
Yeah, it would be good for this person.
Okay.
So yeah, you should get the MRIs done at a reasonable interval. I don't know what that is. But if your doctor says every 5 years, I'd ask, why every 5 years? Why not every 10? Because I'm sure it scares you half to death every time you go in for it. So if there's a reason to do it every 5 years, there's some kind of a growth schedule that says that every 5 years, if it's not checked on, you're likely to run into problems of serious brain loss, vision loss. Anyway, your doctor's treating you the way it should be treated, but this is not cancer.
Okay, thank you. Let's see. I've got lots of questions all over the place coming in. So how about this one from Sarah? She's reached a plateau on the potato starch diet. She's tried Mary's Mini, couldn't lose the rest. What should she do next?
Was it weight loss is the problem?
Weight loss. We've moved on to weight loss.
Okay.
Well, Heather, I hear this, and I've heard this a lot through my entire career. Remember, I've been doing this for 46 years. And people will come to see me and they'll swear that they've got some special metabolism that causes them to stay overweight no matter what you do. I don't believe that. I have people who come in and tell me they have serious eating disorders. They're obsessive compulsive overeaters. They're emotionally and mentally ill, and they eat because of that. And, I've had a chance to challenge a few of them. There's your bushel of potatoes. That's all you get.
Well, I would look at it if they're talking about Mary's Mini, I would consider what kind of sauces and condiments they were putting on the potatoes, or how they were fixing the potatoes. And, to make it as simple as possible, I mean, don't change, just have baked potatoes all the time with nothing on them.
That's what Mary's Mini is.
A lot of times people do Mary's Mini and it was meant to be, really basic with just potatoes and a green vegetable or green and yellow vegetable.
Like potatoes and a green vegetable. This is a diet that is made of ultimate simplicity, but she does allow sauces, and maybe you're talking about peanut sauce.
Yeah. I mean, you never know when people do hash brown potatoes and maybe they put a little oil in them, or maybe the sauce that they're putting over their hash browns has oil in it.
Right, those are good things to think about.
If you just keep it to baked potatoes with no sauce or with a salsa,
Absolutely, just fat-free sauce. Yeah.
Keep it really, really simple.
Yeah.
I don't see that there's any way.
All right, Mary. Well, what if they did Mary's Mini and they weren't adding any oily sauces? What would you tell them to do next?
I would probably tell them to do a little more walking.
Okay, that'd be a good idea. That'd be good. Exercise burns calories. But what else would you tell them when it comes to food?
Oh.
How about the maximum weight loss program?
Well, but then you're adding all kinds of extra
Yeah,
things.
but
Mary's Mini is the ultimate
Yeah.
maximum weight loss.
Well, it's the ultimate simplicity for people who want to follow a diet. The maximum weight loss program is to stress your calorie intake versus calorie outtake to the ultimate point. You see what it does, the maximum weight loss program replaces starch, which is the kind of vegetable food that gives you enough calories to run athletic events, to win marathons. You got calories in potatoes and corn and rice and so on. The maximum weight loss program, what we do is we have you eat more green and yellow vegetables. So
you can do Mary's Mini with less potatoes and more vegetables.
You keep talking about that Mary's Mini stuff, Mary. That must be because it's got your name on it.
Probably.
Yeah, you could do that, but I want to get to the point. Look,
Okay.
All right. How about a diet of just kale? How about kale and cabbage? That's what you get. Kale and cabbage and pea pods. Okay, I'll add what else? Onions. Okay, there you go. See, a lot of variety. I just gave you a lot of. Come on. I have to eat 22 pounds of cabbage to get in enough calories for the day. No, I think there's someplace you can go to lose the weight. And I'm not trying to be condescending in any way. I'm just having a little fun with you. And Mary offered you some principles of simplicity, thinking in terms of diet mentality. I'm offering you some opportunities in terms of changing the calorie concentration of the food. Starches have calories. You need calories. You got to chase that 2-year-old around. You got to go for that walk. You need energy. So to decrease the amount of calories, what you do is you eat foods that have almost no calories. Lettuce, celery.
Yeah. Okay.
Just make that's the maximum weight loss program that we published in 1984. Still a national best-selling book.
Yeah.
We get royalty checks every few months on that book. Keep buying it. People say I don't have any incentive.
Really?
Yeah, really. I'm retired. I got to make some kind of income. Anyway, we wrote some very successful books, and they still pay. And some of them have been on the market for 30 years. That tells you something. The fact that we're still being sold as best-selling books in at least 2 book companies. They're still making money, and they wouldn't be selling our books if they weren't popular.
You've got the truth to tell.
Yeah.
Well, anyway, I hope that we get that question almost every time. Is I do everything you say, but it's not working. I don't believe it. Plain and simple. I don't believe you can live on cabbage. I don't believe you can live on celery. I don't believe you get calories out of the air. These are called breatharians. Okay. When I lived in Hawaii, do you remember that?
Oh, yes, I do.
It hit front page newspaper, a breatharian. There's this man, kind of a hippie kind of guy, who came through Honolulu and gave lectures about how you don't need to eat anymore. You can get everything from the air.
Really? This is true.
Yeah,
I remember it.
They have newspapers articles about breatharians. I bet you can even do it, Google it on and find breatharians. Well, they caught the breatharian down at 7-Eleven buying candy bars.
And of course, they wrote that up in the newspaper.
That was a front page story in the Honolulu Advertiser. So, excuse me, you must obtain calories. If we can make it harder for you to get the calories, then you're going to lose the weight. And again, we don't recommend that people go any more than 50-50 when it comes to the maximum weight loss program. In other words, 50% starch and 50% non-starchy green and yellow vegetables, because you get into 80%, 70% of your diet as celery and lettuce and kale and broccoli. Excuse me, you're not going to stick with the program. Yeah, it's not going to work for you. We're into the long run. We'd like you to do this for a lifetime, not for a week. Why'd you write a diet book? Why'd you write a diet program? It was written with the idea that it fits your diet mentality. You were only going to stay on it for a couple of weeks.
Yeah, to get you over a plateau.
Yeah, but people are on it for years. That's okay. Right. As long as you get that starch in, you've got to get that starch in. Anyway,
Well, I think a lot of people do it because it's so easy, it's
It
just
is, yeah. You don't have to think
one
about it.
starch, one vegetable, and as long
know,
as you get enough.
we can go back to my first memory of meeting Mary, which has been over 50 years ago. When I met her, she was single, of course, and she lived pretty much by herself. And what was your diet back then, Mary? What did you live on?
I lived on canned stewed tomatoes. I would actually heat up a can. I mean, I was on a complete
You were on Mary's Mini plus maximum weight loss.
yeah, without the starch. I ate very little
Did you
starch.
tell me you used to eat baby food too? Squash baby food?
Squash baby food, yeah. I mean, anything that was
Simple.
hardly any calories at all, and it was really simple to make because when I met John, I was not a cook. My mother never taught me how to cook. I never took any culinary classes or anything else, and the simpler it was, the better. And before I had to cook for him, which let me tell you was a real shocker when we got married, and the way he was eating was things I never ever had cooked before in my life. But
it was bad.
when I was eating for myself, it was very simple.
Yeah, some of you know my story. I almost killed myself in my 20s and teens. I had a massive stroke when I was 18. I used to weigh at least 80 pounds, if not 90 pounds more than I weigh now. I was so fat, my mother called me fat. I had major abdominal surgery when I was 25. I'd have been dead or had major surgery by the time I hit my late 20s. But, as you know the rest of the story, hopefully you take the trouble to learn it. I was taught how to eat well by a whole bunch of people living on a sugar plantation in Hawaii. I learned about eating starch from my Filipinos, my Japanese, my Korean patients. Saved my life. I'm 75 now, still kicking.
Thank you. Okay, next question. Nicole would like to know what causes blood clots and how to prevent them.
All right. Well, blood clots, what you do is you need to set up your platelets to be adhesive, want to stick together. You need to decrease the breakdown blood clots. You need to decrease that. And what experiments is that animal fat causes the platelets to want to stick together. And vegetable fat does the opposite. The animal fat decreases the activity of your fibrinolysis, breaking the stuff in your bloodstream that breaks down the blood clots. So it's the saturated fat diet that does it. People say, well, it's from sitting on airplanes for a long period of time. Well, that may contribute to it. But what are you eating when you're sitting on the airplane? Now, the research on blood coagulation is extensive, and you can look it up here easily. And if you put up, saturated fat and blood clots or platelet adhesiveness or fibrinogen activity, fibrinolysis, you'll find all this stuff. It's the animal fat, the pig fat, the cow fat, even the chicken fat. Chicken is full of saturated fat.
Isn't coconut full of saturated fat too?
It is.
And chocolate?
Yeah, but you know what? I'm not going to be as heavy on coconut as a lot of people are.
Okay.
That's a long story. I believe my November 2006 newsletter. Could be off on the month on that one. But anyway, there's a whole discussion on coconuts and how coconuts are the miracle healer. And it was back then, and in the 2000s, people were talking about how you eat coconut and you need to eat coconut oil because it would cure everything. So I've been writing about this for 20 years. But the coconut, my basic philosophy is that nature does things right. And when you look at people who eat coconut, you don't find a high incidence of heart disease.
Well, people don't eat coconut like they eat chicken and
that's true too.
Pork and beef, and they eat a little bit of coconut
as a flavoring.
Yeah.
And besides that, it's hard to get to the meat, isn't it?
It is.
My experience has been opening a coconut is the hardest thing you'll ever do when it comes to nuts.
Well, we've had plenty of experience. We had coconut trees in our yard for years. And I remember you had to find the three little eyes and hit them between the eyes with a hammer.
That's where they broke.
And then they would break apart.
Yeah. We spent many a day, Heather and her two brothers out there smashing coconuts with their camera. It wasn't easy then.
Okay, thank you. Next,
anyways, it's a diet problem. You can thin the blood by taking aspirin or Plavix, or there are all kinds of blood thinning elements. You can thin the blood by eating vegetable oil.
But you don't recommend that?
No, I don't recommend it, because you end up putting yourself in a situation where you're likely to bleed. So if you get in a car accident, you're likely to bleed to death. You know, fish fat is an excellent example. Eskimos, who have a very high fish diet, Inuit Eskimos, they have a reputation for having fatal nosebleeds because the fish fat thins the blood, causes you to bleed. So there are some things you can do to, push things in the other direction, but the main thing is to fix the problem. The problem is eating the animals.
Thank you. Next question. This is from Elise. What can you do for shingles?
Oh, that's shingles is something I never want to get. Some of my patients and best friends have had shingles, and they spent at least a month sitting up in a chair because of the severe pain. It's horrible. And what it's due to is the reactivation of the chickenpox virus. The virus that caused you chickenpox when you were a kid. It lives in your nerves, and then it becomes reactivated when you get to be an adult, and it usually follows one nerve root. So you have a strip of these chickenpox pustules. They hurt like mad.
There's really no treatment for it, is there?
Not really. Calamine lotion. Sometimes doctors will give injections of nerve numbing medication that's long acting. You just try and make yourself comfortable for a period of time. Now, as far as vaccinations for shingles, and they're heavily advertised on TV these days.
Shingrix.
Yeah, thank you. These, as far as I know, they work. And because Mary and I don't want to get shingles, we've had the shingles vaccine twice. As a doctor, I get a discount. It costs me $400 every time we got a shot each, but we felt it was worth it. So, I'm a proponent of vaccines, not all of them. I've got some reservations here, especially when it comes to flu vaccines. But, I don't throw the baby out with the wash water. And vaccination is one of the things that's changed the incidence of disease throughout history. It's a valuable scientific tool. And I encourage you to look at worthwhile vaccines. The pneumococcal vaccines are good. Childhood vaccines that most kids get, polio vaccine. The polio is coming back, they say.
Yeah.
So, but no, there's no, you just suffer, and you take whatever medication you can help you get through it. Now, will it come back again? That's the next question. Can you get shingles twice? Well, I have to look that up. How many times do you need to get a shingle shot vaccine? I don't know, but I've gotten 2. I should look that up.
We'll ask you the question next Sunday. Okay, this question's from Alina. Should you adjust your diet according to your level of activity? For example, if you're more active, you should eat more starches. Yeah. Sedentary, more vegetables, less starches. Does it matter?
Your hunger drive does that. You don't have to think about it. Your hunger drive will be appropriate to your needs. It works as well as your breathing drive. Do you ask yourself how many breaths of air you should take a minute? Or do you rely on your breathing drive? When it comes to thirst, do you count the number of glasses of water that you're taking in a day, or do you wait till you're thirsty? It's a hot day, you get more thirsty, you drink more water. In the opposite situation, you drink less water.
I remember when you used to go windsurfing, you'd come home and eat twice as much food as you usually would eat.
Yeah.
Because you were hungry, and you'd eat right after you came home.
I'd eat a loaf of bread. I'm out there in the cold water for 4 hours on my board, and I burned calories. I burned like 3,000, 4,000, 5,000 calories a session. And when I sat around my computer, maybe 1,400 calories, and I didn't eat as much. So you have to change with activity, but you don't have to think about it. You just say, am I hungry? And if you answer that hunger with the right food, starches, vegetables, and fruits, never fails you. If you answer it with a whole array of food that condemns you to obesity, which are primarily the high fat foods, then the hunger drive doesn't know how to function. It wasn't built in that kind of environment. Whomever our designer was not dealing with a human species that ate meat. People were in the design process were definitely starch eaters. I have no doubt. Anyway,
Well, and the amount of processed food and things that are, I mean, you walk in a supermarket, I mean, it's just horrendous. The variety there is.
Even as simple as flours. We recommend on the maximum weight loss program that you give up the breads, bagels, and pastas, because that they've taken that wheat berry, that starch, and they pulverized it into a food that gives you more surface area for absorption. It releases the calories by the grinding. So yeah, just as long as you keep it to whole starches, your hunger drive will never fail, because it was designed with the idea in mind that the human being is a starch eater. That's the way we're built. I could go from the top of your head to your toes and tell you why you're a starch eater. From the saliva that contains alpha amylase to the teeth that are designed for chewing up starches, not masticating meat, to the hands that are designed to pick up fruits and vegetables, not to tear apart slabs of beef. I could spend at least an hour talking to you about why we're anatomically and physiologically herbivores, plant eaters. But I'm not going to do that today. Next time.
We've only got 15 minutes and lots of questions. Abigail would like to know if all older women need to be on a hormone replacement therapy.
No, absolutely not. And I know women have been threatened many times for many reasons to take hormone replacement therapy. Back 40 years ago, it was taught that estrogens were the secret to youth, and you needed to take estrogens to keep your skin young and keep you looking young, as if a woman needs to look young, right? Anyway, then these days you're threatened by osteoporosis. And there's a little bit of truth to both. I mean, estrogen does keep the skin looking younger, and estrogen does help build bones. So there's a little truth to it. But that was not, again, in nature's design. You weren't designed to take these medications. You were designed to, when you're a child, to not be able to reproduce, not have sexual characteristics, not be in a situation where you're involved with a sexual partner. That's what kids, they're children. And then you get into your late teenage years, and you get into your reproductive years, and and then you get done with having babies. And then it's time for your ovaries to shut down. You're not supposed to have babies after you're 50. Somebody's got to raise them. So your hormones, they drop. But, the pharmaceutical business can't keep out of your reproductive life. So they try and simulate at least a lot of the things that went on when you're in your reproductive years. That's menopause. You stop that phase of your life and your ovaries shut down, and they stop making estradiol. And no, you should, but if you have problems, if you have symptoms that related to menopause, which women do who follow the Western diet, we won't get into why, we can someday, but when you eat the Western diet, you may end up feeling poorly. You have a poor sense of well-being when you go through menopause. You may have hot flashes. You may suffer from sleep problems, depression problems. So you may want to take HRT for those reasons, because the hormones do help, and you might as well go through life feeling good. I recommend HRT as skin creams. There's a whole chapter. Are you giving away the women's book this week?
Yes, it's
No,
available for free.
Yeah, chapter 13 in the women's book, the McDougall Program for Women, is offered free on our website right now, right this moment. You can download it, and it's a PDF file. And chapter 13 tells you all about hormone replacement therapy and how I prescribe it, how I ask women to use it, and why, and what doses and everything. That's called the McDougall website. It's drmcdougall.com, www.drmcdougall.com. And it's there. It's free for you. No gimmicks. It's just there. Pick it up. Read it. Read chapter 13. Tell you a whole bunch of stuff. The McDougall Program for Women. Wait, do we have any other books up for free, or is that the only one?
That's the only one this month, but we'll put some other ones up for free, like McDougall's Medicine. That's a great one, or the McDougall Plan.
Well, we published 13 national best-selling books. Our books have been on the New York Times best-selling list. And of those books, 7 of the 13 belong to publishing companies. They have copyrights on them. I can't give them away. But 6 of the books I own. Mary and I, we have the rights to them, and we're going to give them all away at various times. And when you're listening to this 5 o'clock presentation every Sunday night, we'll try and remember to tell you which book's available. Right now, it's the McDougall Program for Women, drmcdougall.com.
Thank you. Oh, next question. I had my first and hopefully last transient global amnesia attack last Friday. Can you give me some insight into this, and can I ward off another one?
Wow, I've never even heard of that.
Well, maybe they're talking about TIAs, transient ischemic attack, which would give you a global amnesia. In other words, you have a little emboli that goes to your brain, but it's only temporary, and the circulation comes back. There are, I'd have to look it up. I can't carry around the whole medical knowledge in my little brain, so I'd have to look it up. I'd have to look up other causes. But if you're talking about TIAs, yeah, they're caused by the food you eat. Not only do you develop atherosclerosis, which pieces can break off of the plaques in your carotid arteries, for example, and go to your brain. And a little area of the brain temporarily has poor function. It can be due to blood clotting, which we talked about. Usually you form blood clots due to an animal fat diet. Go to your brain just temporarily. If it's a TIA, that means it goes away. Only there for a few minutes, okay? If it's a major closure of the artery and it's complete, it's not temporary, it's permanent, it's called a stroke. And
lots of people have recurrent TIAs.
oh yeah,
right?
yeah. Well, because they keep eating the Western diet,
Yeah.
and they don't take advantage of therapies out there to thin the blood. And there are therapies and there are situations where you should take blood thinners. Like for example, if you're a very sick person and you have atrial fibrillation, but only if you're a sick person. If you're somebody who follows the Western diet, not if you're a McDougall follower, then you don't meet the criteria that are established by the CHADS score, CHADS, CHADS. You can look it up. And this is a scoring system that tells you whether you'll receive more benefit than harm if you take blood thinning drugs like Eliquis or Coumadin or aspirin. So it's only sick people who have are overweight, who have high blood pressure, who've had previous strokes, high cholesterol. It's people who already have poor health. Well, why I say McDougall people don't take these blood thinners is because most of them get rid of their troubles. They end up with low scores on the CHAD score system, and so they're told not to take these blood thinners. There's a lot of wonderful information out there. It's just that you're not made available to that information. And unfortunately, yeah, it's just unfortunate. Let's just leave it at that. That's why you're going to tune in every Sunday night at 5 o'clock. So Mary and Heather and I can give you another point of view.
That's right. Okay, next question. A couple people have asked this, Riki and William, about his wife. So 2 women that have high cholesterol, they eat whole food, plant-based, have done everything that they know to get their cholesterol down. It's not going down. They're not taking medications. What should they do?
Well, I've run across about a dozen women in my 50 years of practice who have a similar story. They'll run cholesterols in the 350 range, ideal being 150, average being about 210. So they run really high cholesterols, and the women I'm thinking about couldn't take statin drugs or didn't want to. And several of them we studied. We did heart scans on them and looked at their coronary arteries, and they were baby clean. Okay, there was no evidence of artery damage. This cholesterol, as I've told you, people don't die of high cholesterol. This is just a sign as to what the healthy arteries may be. In your wife's case, the sign is not accurate. It's not reflecting sick arteries. And so what do? Well, you're worried to death. You just can't stand it. You got an extra $2,000 sitting under the mattress. Go get a heart scan. Every community will give them to you. Just pay the money. I don't know whether they're 2,000 these days. They used to be. So get your heart scanned. Look at the arteries. See
Insurance doesn't pay for that.
I don't think so, Mary.
Okay.
I think it'd be very, very, well, again, things change.
Depends on what kind of insurance you have.
Yeah, things change all the time. And whereas I know they didn't in the past, they may have found it of value. The problem is these are expensive tests, and the translation into better health is not great. So in other words, finding out you have a positive scan usually ended up in surgery, which costs the insurance company more money. It doesn't send you to the dinner table eating beans and rice and corn and potatoes. Now, if it did that, I can't imagine an insurance company not wanting you to get a heart scan. If I could scare you into following our diet by getting a heart scan on every one of you, I would. In fact, I actually thought of doing that one time when we ran the program in Santa Rosa. We had a business open up where they provided these heart scans. And I called the doctor up who owned the business. And I said, could we get your portable scanner to come to, they drive it over in a truck, to come to our clinic and do a heart scan on every one of our participants. That way I'd be better able to motivate them to change and follow a healthy diet for a long period of time. He says, that's a great idea. He says, I just got my heart scan done and it was clean and I went out and ate a big steak. And I said, I'm not going to do that. So you got to be careful what you ask for. I don't think you should routinely be getting heart scans.
Thank you.
Might be reassuring though for someone who,
or it could scare you half to death.
Yeah, but if someone has eaten like this for a long time and has high cholesterol, then
in this case with these two women, if you wanted to throw us a little money on this, we take a bet that it's going to be clean. Anyway, be careful what you ask for in terms of information. So.
Thank you. Next question from Rachel's home. She is considering starting the starch solution. Yeah. However, she's on lisinopril and has stage 2 hypertension. She's 42. She's wondering if it's safe to eat a lot of potatoes while taking that drug.
She's probably talking about lisinopril. ACE inhibitors raise potassium levels. That's what she's talking about. It's a minor issue, very minor. But I'll tell you what you ought to be asking, or what we're going to provide, is you're going to get off the lisinopril if you take the program. Our success rate when it comes to a drug like lisinopril is pretty much 100% of taking people off.
But she has to be careful and do this with her doctor's supervision, because if you start eating this way when you're taking the same amount of lisinopril that you were before,
you could fall over in your mashed potatoes. You get in an auto accident. And of course, that's why we run a disclaimer that tells you that this is not medical advice that you're hearing here. It's entertainment. And anyway, we stop essentially everybody who's on lisinoprils, pretty close to everybody. Our research that's published says that we reduce or stop medications in 90% of people who are on these medications like lisinopril. So the other thing you need to know is that it's not the best blood pressure drug. We do prescribe blood pressure drugs, but we prescribe the one that's been shown to reduce your risk of stroke. None of them have been shown to reduce your risk of heart attack, but there's one class of drugs that's been shown to reduce your risk of stroke. And it's not one class. The one class would be diuretics. It's a kind of diuretic. It's a kind of, it's called chlorothalidone. Thank you very much. Chlorothalidone. It's called chlorothalidone. It was the drug that was originally used about 75 years ago in the veterans study, which showed that you help people prevent heart failure and death and strokes. Chlorothalidone, not hydrochlorothiazide, which is the one that was getting in my brain.
Oh, okay.
It's chlorothalidone. That's the one we use. We use the one that works. That's been tested. That's anyway, lisinopril, what your goal should be to get off that drug. And you do that by getting good medical advice, and tells you whether or not it's really indicated, if that's the best drug. And you do it secondarily by getting your health back. And it's the food. And the best way to get your food fixed is we run a 12-day program. We're running one right now. We've got a whole group of nice people involved with us for the next 12 days. And we run these every month or two. And so you want to get involved with the 12-day program. We'll help you get on with your life, get off your drugs that are unnecessary, and get the weight loss you're looking for and the health that you're looking for and deserve. You're not supposed to be sick. It's the food.
That's a great thing to end on. We've run out of time. That hour went by so fast.
It was good. It was fun. We got onto a lot of topics, didn't we, Heather?
We did.
Yeah.
Well, we'll be
Yes.
here next Sunday. And so if you have friends or relatives that need to meet Mary and John and Heather, tell them tune in. It costs nothing. They won't be identified. They won't go on any hit list.
And these people can all come back
Yeah,
and
we
ask
want you to
more
come back.
questions.
We want you to come back. And you can take
Yeah.
advantage of other educational opportunities we have, like lectures we give and, the 12-day program. And, we got lots of things going on to help you.
Yeah, please visit our website. I know I didn't get to everyone's questions, but you can find a lot of the answers to your questions on our website, which is drmcdougall.com. It's been a great hour. Thanks, Mom and Dad, Dr. McDougall and Mary. Thank you, everyone, for being here. We'll see you all next Sunday at 5 p.m. Pacific. Take care, everyone. Have a great rest of your day. Bye.
Bye.
Bye-bye.